Healthy gut versus inflamed gut. Everything you need to know. You might think your gut is fine, but if you have gas, bloating, brain fog, or fatigue, your gut may be inflamed and silently wrecking your health. In this video, we're breaking down the key differences between a healthy gut and an inflamed gut, what each one feels like, and how it impacts your energy, your digestion, and your mood. You'll discover the hidden signs that says your gut may be in trouble, and they're not all digestive. The proven steps to start healing it, and whether probiotics actually help or just waste your money. And stick around to the end because I'll reveal the number one mistake even clean eaters make that keep gut inflammation ongoing for years. Hi, I'm Dr. Laura Van Bryce, a chiropractor and functional medicine practitioner, and I combine the best of traditional and alternative medicine using a thorough approach to understand your health needs. My mission is to help you live your best life by supporting your journey to optimal health and wellness. And before I dive in, go ahead and subscribe to my channel if you want practical tips and strategies that can help you live a happier, healthier life. I upload a new video every week. A healthy gut does more than just break down food. It plays a major role in how you feel physically, mentally, and emotionally. When your gut is healthy, you have steady energy, clear focus, emotional balance, and smooth digestion, and no bloating, gas, or discomfort after meals. It feels like your body is supporting you. Now compare that to an inflamed gut. You feel tired even after a full night's sleep. Your digestion becomes unpredictable. Foods that were once fine now leave you bloated or uncomfortable. Mentally, you might feel foggy, irritable, or anxious without knowing why. An inflamed gut drains your energy, disrupts your digestion, and throws off your mood. So what causes that difference? A healthy gut has a balanced microbiome represented by a wide variety of good bacteria that support digestion, nutrient absorption, and your immune function. The gut lining stays intact, keeping harmful substances out of your bloodstream. Bowel movements are regular and comfortable, and inflammation stays low, which keeps your body resilient and your mind clear. An inflamed gut is just the opposite. The microbiome becomes imbalanced. Harmful bacteria crowd out the good bacteria. The gut lining becomes leaky, allowing toxins into your bloodstream, which then triggers widespread inflammation. This chronic inflammation leads to digestive issues like bloating, gas, diarrhea, and constipation, which then can develop into bigger problems like IBS, IBD, skin irritations and flare-ups, and joint pain. So how do you know if your gut is actually inflamed? Most people think it's just bloating or stomach pain, but the signs go far deeper beyond digestion. Yes, gut symptoms like gas, diarrhea, constipation, or cramping are big red flags. But if you're also dealing with low energy, constant fatigue, skin flare-ups, food sensitivities, or mood swings, your gut could be the reason. Even brain fog and anxiety have been linked to gut inflammation. That's why they call it the gut-brain connection. Did you know that your digestive system talks directly to your nervous system, and when your gut is inflamed, it affects how your brain functions? If these symptoms are showing up regularly, your gut is trying to tell you something. So let's talk about some of the most effective steps that you can take to start calming down the inflammation and repairing your gut. The good news is your gut can heal, and you don't need a complicated protocol to get started. The foundation is simple. Eat more real whole foods, especially ones that feature good bacteria like vegetables, fruits, legumes, and whole grains. These give your gut the fiber it needs to thrive. Next, add in fermented foods. Things like yogurt, kefir, sauerkraut, kimchi, and miso are rich in natural probiotics. These help restore healthy bacteria and reduce inflammation. But food isn't everything. Stress is one of the most overlooked causes of gut inflammation. When your body is constantly in fight or flight mode, your digestion shuts down and inflammation rises. So if you're not managing stress, your gut won't fully heal. even if your diet is perfect. Exercise can help too. Just 20 to 30 minutes a few times a week boosts circulation, improves digestion, and supports your microbiome diversity. And finally, be careful with antibiotics. They wipe out the bacteria across the board, including the good kind. Only use them when truly necessary under the guidance of your physician, and always focus on rebuilding your microbiome afterward. So that brings up the big question. If antibiotics wipe out good bacteria, can probiotics help bring them back? And are they actually worth taking or just overhyped? So let's break this down a little deeper. Probiotics are good bacteria that can help restore balance in your gut, especially after it's been disrupted by stress, poor diet, illness, or antibiotics. And while they're not a cure-all, the right probiotics can support the healing process when your gut is inflamed, and here's how they work. Some strains help reduce inflammation by calming your immune system. Others help strengthen your gut lining, which is key if you're dealing with a leaky or compromised gut. And many probiotics compete with harmful bacteria, preventing them from taking over. But not all probiotics are the same. Different strains do different things. For example, Lactobacillus rhamnosa is great for the gut lining support and immune balance. Bifidobacterium bifida can help with digestion and regularity. Saccharomyces boulardii, which is actually a beneficial yeast, is especially helpful during or after antibiotic use. I've also recently learned about Lactobacillus reuteri, Lactobacillus gasseri, Bacillus coagulans, and Bacillus subtilis, thanks to Dr. William Davis and his Super Gut program. So if you ever felt like probiotics didn't do much for you, it might have been the wrong strain for your specific issue. Now let's talk about how to take them. A lot of people ask whether probiotics should be taken with food or on an empty stomach. Research shows that they often survive better when taken with a meal or right before eating, especially if there's some healthy fat present. It gives them a better chance of surviving the acidity of your stomach, and consistency matters. If you're going to take a probiotic, take it daily and give it time. These aren't instant result supplements. They're more like gardeners for your gut. They help create a better environment over time, especially when paired with the other gut healing strategies we talked about earlier. One last thing, probiotics work best when your foundation is solid. That means a clean, fiber-rich diet, managing stress, regular movement, and limiting things like alcohol, processed foods, and unnecessary medications. Used in the right context, probiotics can absolutely help support gut healing. Just make sure you're giving them the right environment to actually do their job. Now here's the part almost no one talks about. Even people who eat clean, avoid processed foods, and take all the right supplements can still struggle with gut issues for years. Why? Because the number one mistake is ignoring stress. You can have the perfect gut healing diet, take high quality probiotics, and eliminate all the so-called trigger foods, but if your body is stuck in stress mode, your gut will likely stay inflamed. Chronic stress weakens the gut lining, disrupts the microbiome, slows digestion, and keeps your immune system on high alert. It's like trying to put out a fire while pouring gasoline on it every day. That's why some people feel like they're doing everything right and nothing's changing. It's not their food, it's their nervous system. So if your gut issues aren't improving, it's time to look beyond your plate. Start creating space for recovery, not just physically, but mentally and emotionally. That's where real healing starts, and that's what finally gets the inflammation to go down. One of the simplest and most effective ways to lower stress and support your gut is deep diaphragmatic breathing for just 3 to 5 minutes a day. Here's how it works. When you breathe deeply through your diaphragm, it activates your parasympathetic nervous system. This is your body's rest and digest mode. It signals to your brain that you're safe, which helps reduce inflammation, improve digestion, and tighten the junctions in your gut lining. So here's how to do it. Simply sit with your feet on the floor, breathe in slowly through your nose for 4 seconds, letting your belly rise, hold for 2 seconds, Then exhale through your mouth for 6 seconds, and then repeat for 5 rounds. It may sound simple, but this one habit can shift your entire gut environment over time because it gives your body the safety it needs to heal. If you've been living with gut issues, whether it's bloating, brain fog, skin flare-ups, or just not feeling like yourself, I want you to know this. You're not stuck and you're not broken. Your body is always working to heal. Sometimes it just needs the right support. Small, consistent steps can make a big difference. So start where you are with food, with breath, and with your awareness. Your gut can heal and you deserve to feel better. If you found this video helpful, give it a like, share it with someone who needs to hear this, and leave a comment below. What's one thing you're going to start doing today to support your gut? And don't forget to subscribe. I release new videos every week to help you live a healthier, more energized life. And if you want to go deeper into how gut disorders like IBS, IBD, or SIBO are treated at the root cause level, watch my next video, How Functional Medicine Treats Gut Disorders. It's the perfect follow-up because it shows how functional medicine looks beyond the symptoms to fix what's actually driving your problem. That way, you can finally get long-term relief.